interesting. And if people wanted to get this information, I imagine it's at the mass.gov DPH.
It is. There's a link right from mass.gov/DPH. We also have, for folks who might not have internet access, a 211 line. So people can call 211 and they'll get a live person to give them any information they might need to know about the
anything. So if I'm sitting at home and I'm watching this right now,
right,
and I want to ask a question about the vaccine,
right,
I can call 211?
You call 211 and they would tell you exactly what the latest state of knowledge is.
If I'm sitting at home and I'm wondering, am I in one of the risk groups for being a priority for getting the vaccine?
Right.
Call 211.
Call 211.
If I think I might have H1N1, what should I do? Should I call 211?
Well, if you wanted to know what the symptoms were, you could call 211 and you could get that. But also you might want to call your primary care provider or whoever you get your health care from.
Great. And I know that Commissioner Auerbach, who's done a great job on this issue particularly, has been very proactive in getting information out there. And some of the information that I think, fortunately or unfortunately, however you want to look at it, has been about some of the disinformation that's going on right now. And I know as a legislator, I'm getting a lot of emails. I know that as I sit here right now, there's probably a couple coming into my mailbox, email box right now, from people who think that there is this thing called a mandatory vaccination program. Do you want to speak to that?
Sure. First and foremost, there is no mandatory vaccination.
Will there be?
And there will not be. I know there's legislation for the legislature that will lay out some emergency powers that the state will have, but even under a public health state of emergency, there will not be mandatory vaccination. You always have the right to refuse. Sort of your sovereignty within your body is actually absolute, and we cannot force. And actually, we think it's bad public health. When we come out around the state and say either there's a public health emergency or there's sort of infectious disease, we want people to trust us and listen to us and engage us. The last thing we want is people to start hiding under their beds or sort of going the other way when we come in because they think we're going to force something on them that they don't feel comfortable with.
So the idea that we're going to be, the state is going to be rounding people up, bringing them down to some inoculation center and getting a shot in the arm is just total. There's precedents in history for the United States anyway, or the state too, having some type of an infectious or contagious disease and not doing that, right? Smallpox or mumps and measles.
We've had lots of. There've been many infectious diseases. The only mandatory, and even that's not inoculation. There is some language on mandatory treatment for tuberculosis, and that's really sort of an artifact of when if you didn't let it treat, it could really spread.
Right.
But
You mean the TB thing was from before they had treatments for it and they had to isolate
Exactly. Yeah. But part of what we're trying to do with this legislation is to sort of update the laws, which haven't been revisited in 50 years, and just make sure that we have the appropriate powers, but also that there's appropriate protections for folks.
And appropriate powers, but not overreaching powers.
Exactly.
Yeah,
exactly.
At the same time, because you're right. I think if there were policies like that put in place, that it would drive people away from getting help instead of. So what are some of the things besides the dial 211 to get information about the H1N1? Is 211 only for H1N1, or is that for any?
211 is right now is just for H1N1 concerns. People can always call the Department of Public Health, which is 617-624-6000, for any kind of public health question, and those calls get routed. And if you call about the legislation, it ends up on my desk. But a lot of folks can get information through that. Our website is active, and
it's mass.gov/DPH.
Right.
Or if they just go to mass.gov, they can find the link on the homepage.
Yep.
And so it was said before that we've had about 1,400 cases.
We've had 1,400 cases. We've had 11 deaths in the state so far. The hospitalization rate has been about 12%. What makes the swine flu different than the seasonal flu is really that it's focused much more on younger folks. Less than 10% of the cases have been people who are over 65 years old. So sort of the people who were used to saying you really need to pay attention because you know, the flu's coming and it's dangerous, they've actually been less impacted by the swine flu than typical. So we're adjusting our message a little bit, and that's why we're working with schools so much. We do weekly calls with school superintendents, local public health officials, just so they know the very latest of what's happening.
Great. So will DPH be distributing vaccine? Is that where it's coming through? Or?
DPH will be doing the initial distribution. Sort of, it comes in through the department, and we're sort of assigning around the state.
Where does it come from?
The H1N1 vaccine is entirely purchased by the federal government. So we get it all from the feds. If someone tries to charge you for H1N1 vaccine, you shouldn't be paying for it because the federal government has already bought it.
Well, that's an interesting point. That I didn't even know that this is a free. This is a free shot.
This is a free. The vaccine itself is already paid for by the federal government. There may be administration charges.
Okay.
So if you go to a Minute Clinic or your doctor, though we're trying to do our best. We really want to get it out there. So we want to make this as low a barrier.
So if you go to a CVS, for example, to get this, there may be a fee for them handling it.
Right.
But there's no charge from the government on the drug.
Right.
Or
You're not paying for the stuff.
Vaccine. Okay. Yeah.
You may pay for the administration, but you're not paying for this for the stuff. And we have we've expanded. We've done new regs to expand the number of folks who can give the vaccination. Just so.
Who can give the vaccination?
Well, your normal folk, doctors, nurses, paramedics, EMTs. We've expanded it actually so that advanced medical students and nursing students can, because we want to sort of be able to spread the blanket across the state as wide as possible and not, not have people unable to get the shot because there may not be enough nurses in your town or doctors around. So we're trying to expand that.
Yeah, we typically have a regular flu shot day at the State House every year that I go to, and I think there have been nursing students and med students who've given those, right?
Right.
So this is sort of, just...
Yeah, it's just building on that practice.
On that practice. So we'll have more people out in the communities giving these shots than we currently do. Is there anything else you'd like to bring up from the State Department of Public Health perspective on this virus?
Just that we really, we rely on working closely with sort of the local boards of public health and the municipalities, and what we'd like to do is to sort of effectively get sort of the information and the science that comes from the federal government, the resources that we have at the state, and really get them out to the cities and towns, because that's what's going to make us all protected. Yeah,
and you folks are working directly with agencies like the Berkshire County Board of Health Association, the Tri-Town Health, who have been here, and the Pittsfield Board of Health, and all the other boards of health that are around. And as Sandra said, who was my last guest, she was talking about how in most states this is handled through the state works with county governments, but we don't have county governments. So
no, but we've got good partners out here. So
absolutely, great partners out here. So, and again, if folks have concerns, anything to do with H1N1, they should call.
They should call 211, or they can go to our website, www.mass.gov/DPH, and click the H1N1 swine flu link.
And I think having the 211 number as a person who represents a lot of towns that don't yet have, and we're working on the problem, don't yet have broadband access, having the phone information is very vital, and particularly for older folks who may not be as well versed on the computer.
Exactly.
So I think that was a very smart idea that DPH had in getting the information out.
Yeah. We want everyone to know what they need to know to try and stay healthy.
Great. So Dan, I want to thank you for being here today. Thanks for coming out.
My pleasure.
I know you've got some other meetings in the area today going around, so I appreciate you taking time out of your busy day to meet with me and to get the information out to the people here who need to hear it.
Great.
Okay.
Thank you.
Thanks a lot.